The NEET PG question of the day. So here's the today's question. MRI shows destruction of D8 and D9 vertebral bodies with marked narrowing of intervening disc space and a large paravertebral abscess. The most likely diagnosis is option A metastasis, option B tuberculosis, and option C osteoporosis, and option D multiple myeloma. Pause the video for a few seconds and think about the answer and comment the answer. So, the correct answer here is tuberculosis. Now, many of you get confused between spinal TB and metastasis and all these things. Yeah, so let's look at the findings one by one. So, first thing here is destruction of D8 and D9 vertebral bodies, and second one is narrowing of intervening disc space, and third one is large paravertebral abscess. So these are your clues for this question. So the most important in these three is intervening disc space narrowing. So what happens in spinal tuberculosis? It's also known as spot spine. Here, TB involves the disc and spreads to adjacent vertebrae and forms a paravertebral abscess. This happens in spinal TB. So, MRI findings in the paradiscal TB. Paradiscal is nothing but a type of TB where it involves the lower half of the upper vertebrae, intervertebral disc, and upper half of the lower vertebrae. This is how its pattern is. So, infection starts near the vertebral end plate and it spreads through the intervertebral disc to the adjacent vertebra. So here, disc is involved plus two adjacent vertebrae are affected. So the spread pattern here is vertebra, disc, and the adjacent vertebra. So because of this pattern, so we commonly see two adjacent vertebra involved and disc space narrowing and paravertebral abscess. So now when we compare this with metastasis, metastatic cells reach the vertebra through bloodstream and usually involve the vertebral body itself. The intervertebral disc is relatively avascular, so it usually spared. That means the disc space is often preserved in metastasis, and paravertebral abscess is also uncommon here. So the most important take home rule here is whenever you see there is disc space narrowing plus involvement of two adjacent vertebrae and paravertebral abscess, just think it as spinal TB or pot spine. So you have your rule for exams. If the disc is involved, think it as TB. If the disc is preserved, think it as metastasis. So the thing is, if the disc is good, that means it is preserved, you are in danger because you get metastasis. If the disc is bad, you are okay. I mean, at least you are not having the metastasis. Options too. Osteoporosis is one option. This causes vertebral compression fractures, and this does not cause disc space narrowing or paravertebral abscess. So, that is not your option. And when we come to multiple myeloma, it causes lytic vertebral lesions and its collapse. So, intervertebral disc is usually preserved, and abscess formation is very uncommon here. So, your go to option here is tuberculosis. Whenever the disc is preserved, you may think these other options. Compare this spinal TB and metastasis. So, as I've said, in spinal TB, disc involvement is present, and in metastasis, it is usually absent. Disc space narrowing is present in spinal TB and it is usually preserved in metastasis. The vertebrae involvement in spinal TB is you see the two adjacent vertebrae. Yeah, the pattern is vertebra and disc and the adjacent vertebra. So in metastasis, it may be single or multiple, and basically, this is non contagious. So, paravertebral abscess is very common in spinal TB and it is rare in metastasis. So you can also remember these points, usual location and typical patients. So the thing we need here is imaging pattern. In spinal TB, we get destruction of two adjacent vertebrae, narrow disc and paravertebral abscess. Whereas in metastasis, you may see vertebral body destruction and preserved disc space. So This is the most important takeaway point for you today. Thank you guys. See you in the next MCQ.